Good evening, good morning, good afternoon, viewers, depending on where you are watching us from. Thank you. Today, we are going to talk briefly on how to use your common sense. The question is, what is common sense? Many times we talk about use your common sense. Can't you use your common sense? Why are you not using your common sense? Are you deaf or dumb? Use your common sense. These terms are common amongst us in our everyday activities. The question is, what is this common sense? How and what do we do to convince someone around us that we are using our common sense? And in our Igbo cosmology, common sense is regarded as akonuche. Akonuche. So now, now, what are the things that we do on a daily basis that can warrant one or warrant us to apply common sense? It's very simple.
Okay, sir, you've been talking about this common sense for a long time, and today, believe me, is an honor and a pleasure for me to host you on this platform.
Yeah, thank you.
Actually, I've been talking about how a woman can provoke the miracle of conception by the application of three principal things, or what I call cardinal pillars of this particular program, which include the principle of transformative prayers, medical exploring good medical and standard medical sound medical options, and the principle of kingdom mysteries, engaging in kingdom principles that best results. And I want to know, is there a way this common sense is applied directly or indirectly to achieve this core result of conception in this issue? What do you have to say?
Thank you. Yes, common sense is applied in every aspect of our life. But specifically, you talk about applying common sense in our health, applying common sense in conception.
Okay.
Now,
Today we'll be looking at that common sense in conception.
common sense in conception.
Yes, I think that is where we'll dwell much today. Go ahead, sir.
Thank you. Now, in conception, I think I should say that God, who is the architect of conception,
Okay.
creation,
Okay.
created man to conceive
All right.
and to increase and multiply.
Yes.
The same God cannot exercise most of his powers without man.
Okay.
Man is a stakeholder in creation.
Okay.
He's a stakeholder in God's agenda. So for God's finger, for God to extend his powers, he needs man.
Okay.
Now, what am I trying to say is this. A woman who wants to be pregnant or want to conceive need God.
Okay.
He need God. He need prayers. He need a doctor. So, what are the roles that God can play for the woman to conceive? That is the issue of prayers.
Okay.
The issue of prayers. Now, the other aspect is he needs what? He needs a doctor.
A doctor.
Yes.
Okay.
So it's the doctor now that can come now to guide you on the things to do to conceive.
Okay.
Many times we pray, and there are things that we should do for that prayer to become effective. Now, this effectiveness is anchored on knowing what to do, what to do at the right time.
The right thing to do.
The right thing to do. So now, visiting a doctor will now tell you maybe your fallopian tube has a problem, or that you have infection.
Yes,
you
there are
have
other factors.
So he now diagnose you. That diagnosis will now help you to position you for that conception.
Beautiful.
You need to see the powers of what? Prayers.
Yes. Thank you very much. Listeners and viewers, if you are just joining us, we are talking on. Here with me is the expert in common sense who has written so many books. If you don't have his books yet, please order it from Amazon today, or you can check the link below and he'll send a copy to you. We are talking about utilizing common sense while believing God for conception. God actually, like he said, is the architect of all things, but there are places for common sense. And if you're just joining us, you are welcome on this platform today. I know you are going home with tangible thing that will put your miracle in your hand. So before we round up on this segment, I still want to ask her, when the place of common sense is neglected on this journey, what do you think will be the outcome?
It will be catastrophic. Very, very catastrophic.
You said it's going to be catastrophic.
Catastrophic.
That's
Yes.
okay. Can you expatiate, sir? Can you
Yes,
expand on this?
I will.
All right.
Yes, because as I said, that a woman who needs a baby or a child needs God, needs man,
Okay.
or needs God, needs prayers, needs doctors. Now, when these things are not put in place, you understand,
Mm.
it may mar the dream